Go. Okay, so good afternoon, everyone. Thank you for joining us for our Mayor's Wellness Campaign webinar for our Mental Health Initiative RFP Technical Assistance webinar. It's just webinar over and over again. My name is Katie Pizaha. I'm Program Officer here at the New Jersey Healthcare Quality Institute. And just before we get started, I just wanted to go over a few little housekeeping items. The webinar is going to be recorded and posted on our website after the presentation. So if you or a colleague is missing this or you need to reference back, it will be available to you. I encourage you to ask questions by typing them into the chat box. I will answer questions at the end just so that we could kind of go through the presentation because you'll probably get a lot of those questions answered. But also Julie is here too, and she'll be able to answer any of your questions in the chat ahead of the end of the presentation. Yeah, so we're going to just get started then. Just some background information about the Quality Institute. Our mission is to improve the safety, quality, and affordability of healthcare for everyone. And we bring together over 100 unique member organizations, all committed to helping us achieve that goal. And we have 3 areas of focus, which are policy, quality improvement, and community health. And the Mayor's Wellness Campaign is a part of that community health area. Okay, so if you're not familiar with the Mayor's Wellness Campaign, maybe you're new, just some background information on that. It is an initiative in partnership with the New Jersey State League of Municipalities, and the Mayor's Wellness Campaign provides evidence-based tools and resources to mayors and community leaders so you can improve the health and wellness of your community. This is weird. And with the Mayor's Wellness Campaign, mayors have the platform and tools that they would need to make their communities a healthier place to live, work, play, and age. And we have over 400 participating communities throughout New Jersey. Okay, so we're going to kind of just jump in to the overview of the program, the RFP rather. So in partnership with the New Jersey League of Municipalities and funded by Walmart, the Quality Institute's Mayor's Wellness Campaign has issued a request for proposals focused on addressing community mental health needs. And so those programs can address mental health, substance use, intimate partner violence, and or any stigma associated with those 3 areas. And the Mayor's Wellness Campaign mental health toolkit can be utilized for program ideas. So I do encourage you to take a look at that as well. This is the funding that is available. Municipalities can apply for $5,000, $10,000, or $15,000 in funding, and there will be up to 10 awards totaling $67,500. And to be eligible, you would have to be a New Jersey municipal government agency, part of the Mayor's Wellness Campaign. If you're unsure if you're a part of if your municipality is part of it, or if you want to sign up, you can either reach out to myself at my email address, and we'll post that at the end, or you can sign the pledge on our website. And only one application per municipality will be accepted, so make sure you're in communication with the different areas of your municipality, because if the library applies and the rec center applies, we can only accept one of those applications. Okay, and this is the timeline for the grant. One of the new areas of reporting that we added last year was just a schedule of interventions that will be due in January. This just helps us outline the awarded communities' activities and interventions for the grant period, and that includes the name, description, target audience, and what community partners are involved, and what the estimated planned dates are. The idea is that will just help awarded communities to stay organized and provide opportunities for technical assistance from myself and Julie as needed. And then there is also an interim report that is due in May, as well as a final report due in November of next year. And the responses for today's RFP are due September 12th at 5 p.m. We won't allow any late submissions, so make sure to submit that on time. Okay. And as we discussed earlier, these are the types of programs that we are looking to fund. So anything related to mental health, substance use, intimate partner violence, and or stigma related to those three areas in your community. And specifically, we're looking for initiatives that use the Mayor's Wellness Campaign to plan, develop, and carry out the programs that focus on underserved or marginalized populations, provide community education about mental health, substance use, intimate partner violence, or stigma associated with those, promote and increase access to healthy coping strategies in times of stress and crisis, help community members feel a sense of belonging, utilize a holistic approach to promote health and well-being, and increase access to affordable mental health care. So it can address any of those areas or a few of them. Okay, so we're going to go over the application. The application looks pretty similar to the last 2 years. So if you are familiar with it, a lot of this will be familiar to you, but we have added in some additional pieces. Specifically, number 5 is just asking for a secondary name and contact information for the proposed grant reporting, just so that if there's any potential issues such as turnover for the position, we'll be able to reach you regarding any of the grant reporting. And then the request amounts have changed to $5,000, $10,000, and $15,000. And the amounts that you're requesting should reflect one of those 3 numbers. Okay. So most of this is going to look, again, the same, but I just wanted to give some examples so that you understand like what we're looking for when you're answering these application questions. So number 6 is going to be to provide an overview of the program. So this is what it is, what it's going to look like, and be sure to clearly explain how your program will connect to one or more of the following focus areas. So the mental health, substance use, intimate partner violence, or stigma. And then just like try to avoid assumptions and describe the connection explicitly, right? So the example on the screen, I'm just going to use that throughout the whole entire discussion about the application. So this program will offer biweekly support groups for LGBTQ plus youth, age 11 to 13, led by a mental health professional and peer mentor, and it addresses mental health and stigma by creating a safe space for connection, open dialogue, and coping skill building. Obviously, you can build on that, but that's just an example that really hits those areas of what is the program, who is it for, what is the intent, and what is it going to address. And then you have your program goals. So strong applications will have a clearly stated goal that addresses mental health, substance use, intimate partner violence, or stigma with evidence-based interventions. So it should connect the project description. For example, if your project description is to educate, raise awareness, and provide resources to your community about mental health, it should connect to the goal, which could be to increase awareness and understanding of mental health issues within your community. So we want to know what changes that you're hoping to make for your community. And I encourage you to write your program goals as like a SMART goal. So that's specific, measurable, achievable, realistic, and time-bound goals. And in the RFP, there is a link that gives you a little bit more information about what that means. So for example, you want to improve the mental health outcome for LGBTQ plus youth by reducing reported feelings of isolation and stigma by 25% over 12 months, using peer-led outreach and access to affirming mental health education and resources, right? So we're using all 5 parts of that SMART goal model. And then for target population, we want to know who is your project for. We want to tell you to tell us who is the main group of people it'll help, including demographic details and why the group was selected. For example, we would say last year I conducted a community survey and then I found that LGBTQ plus youth reported feeling the most disconnected from their family. So because of those findings, we're going to focus this program on this population to increase their sense of belonging and support. So by clearly identifying a specific target population, this will strengthen your application. So general responses like everyone can make it difficult to assess the program's focus and its potential impact. So it's really important for you to be specific. It doesn't mean that these programs can't be accessed also by people outside of this area or your focus area, depending on what the program is, but you want to make a concentrated effort to a particular group. And now we're going to move on to question number 9, which is about underserved communities. So will your project help an underserved group in your community? Who are they? Why do they have a harder time getting care or support that they need? And how is your program going to meet their needs, right? So for example, if your target population is LGBTQ plus youth, your strategies should include a specific way to reach that group. So that might be something like partnering with your LGBTQ plus youth serving organizations, your school's GSA club. Maybe there's a specific program that's run in your library for LGBTQ plus youth, really just trying to find how you can actually reach those community members and how you're going to do so. Underserved groups are people who may have a harder time getting healthcare services or other support because of things like income, race, ethnicity, language, where they live, their age, their disability, gender identity, sexual orientation, or immigration status. And those challenges can often lead to worse health and fewer opportunities to stay safe and well. Okay. And now question 10 is really talking about who are the community partners that you're going to be working with to make this project successful? So is that your municipal department, schools, health systems, providers, community organizations, right? And you'll just describe here how you plan to work with them. I do encourage you to include partners with mental health expertise, as that is strongly recommended. Just because if your project is focused on mental health, you want somebody in the room that has great knowledge and expertise about that, about this topic, right, to help lead your programming. So this should improve, these partners should include those subject matter experts in the area that you choose to focus on. So for example, if you intend to provide education to parents of LGBTQ plus youth about mental health, you would want to partner with a mental health expert to provide those workshops. And then if you were to include a local youth serving organization that serves LGBTQ plus youth, but you don't have an established connection, or at a minimum I would recommend at least at a minimum introducing yourself to them. You may run into delays in starting your activities. So if you plan to work with somebody on this project, I would at least let them know. And be like, hey, we're applying for this and we would love to partner with you on it. Because what happens is if you have your project accepted and then you're supposed to work with this youth serving organization, but they had no idea about it, you're going to run into delays in starting your activities. So form those connections before the grant period. So if you're listing them as a partner, they should really know they are a partner. Okay. Now just kind of moving on to the project activities and timeline. So this is what are the main activities your project will include? So we want to see a general timeline for your project. So you can list that as a timeline, a chart, or a bulleted list. And just as an example there, it says like months 1 to 2, we're going to plan and do resource development. And that includes finalizing our outreach plan and messaging, identifying and training LGBTQ plus peer leaders and facilitators, and developing a culturally affirming mental health resource material. So just be specific. It doesn't have to be every detail, but have a good idea of what your process may look like. Okay. And let me think if there was something else here. Yeah, just make sure that this timeline is realistic, right? You're not going to start your trainings. Well, generally speaking, you're not going to start your workshop like the day that the grant started, because you have to kind of formalize those other parts like the planning and resource development ahead of time. Okay. And then with program evaluation, we're looking to know how you're going to know your program is working. So what are you going to look at or measure, and how will you collect this information, including specific metrics and methods? So Attendance can be counted toward this measurement, but it is important that it is not the only measurement. So some examples of evaluation tools that could be used to measure success are pre and post surveys for events, feedback from partners and participants, focus groups, number of resources distributed, number of health screenings conducted, follow-up assessments after a few months to measure the impact and outcome measures. And for our example that we've been working with, right, it might be we're measuring the number of youth that we've reached through the workshops and outreach, and then change in self-reporting isolation and stigma. So maybe you do a pre and post survey, and then resource utilization, whether that's downloads, clicks, distribution rates, and like how they've engaged with you. So likes, comments, shares. And then just some of those methods are like anonymous surveys at project start and end, attendance tracking at events and workshops, online analytics for the digital materials and campaign that you've reached, and qualitative feedback collected via optional post-event reflections. And I know it's hard to see, but like one of our grantees this year, who is Wildwood Crest, they obtained a testimonial from the two women or the women in the photo, talking about how that this program has helped them and supported their connection to each other, right? Okay, and then 13 is an added on question, and this is about sustainability. So it's what is going to happen to your program after the grant ends? And if you have any plans to continue, share with us how. Right. So this section asks you to think about what's going to happen, right? So we want to see that you've considered how your project could be sustained, even if even in part beyond your funding period. And it's really okay if you don't have everything figured out, but offer a realistic plan. So for example, you might seek new funding or build partnerships to share responsibility or embed the program into something existing that you already do for the community. If your project includes low cost or peer-led elements, you can highlight how these support sustainability. You can also mention the materials that you develop or the trainings that you do or the infrastructure developed during the grant, and how it might be continued to be used. And really, this is going to be a short, clear paragraph, maybe like 100 to 150 words at best, that shows intentional thinking about the future of your work, right? And then there's the example there where we plan to seek additional funding and partner with local LGBTQ plus and mental health organizations to continue the program. My headset turned off. I don't know why.
You're good. We can hear you, Katie.
Great, thank you. So yeah, peer-led activities are low cost and easy to maintain, and resource materials will remain available online. So long-term, we plan to embed the work into ongoing community programs, such as at our local library, right? Okay, and that kind of does the overview of the application questions. The last portion here is about the budget, right? So there is an Excel form on our website, and we're looking for you to provide a very brief description of each line, kind of as outlined in this example. And you want to match the timeline and the activities, what the allowable costs are, and then that incentives should be impactful, not just a draw for people to come, right? So we want them to have some level of impact aside from like getting people to attend. You don't have to fill out every line. I just filled out each of the lines that are available just so that you have an example of what we may be looking for. We really just want that budget to clearly align with your description, your goals, and your activities. And they should be consistent with the grant terms as well. So if you're saying like, we're going to host this outside of the grant period, that's not going to, that wouldn't work for a accurate budget. So it has to be incurred within the time frame specified. And just remember to like think about what is that intention for giveaway or incentives? Are they to reduce barriers for residents, or is it just to make sure that residents are attending? Okay. And then these are just some important reminders. So we would like you to attach only the PDF and the budget Excel form. to the email. Just note any of the page limits and format requirements. Application should be submitted in single space, Times New Roman font size 12, and should not exceed 4 pages in length. And the applicants will also have to, as we discussed, submit a budget form provided by the Quality Institute. And be sure to answer all the questions. I have received some applications where 1 or 2 questions just wasn't included, right? So if all the questions aren't answered, we won't be able to review them. And the application deadline is Friday, September 12th at 5 p.m. And just as a reminder, we will not be accepting any late applications. But if you do have any questions, like feel free to send them over my way or Julie's way. And now we are at the questions. So I'm gonna double check if there's any in the chat. And then I did receive a few from folks that had registered. Okay, and yep, Julie answered all the ones there. So I had some preemptively. Can this RFP fund mental health first aid courses, fund speaker fees for presentations to the public on mental health issues? Yes, absolutely. Those are 2 things that can be funded. Is the grant money given directly to an applicant or given to the town? This should be applied with your town involved. This shouldn't be applied to by a single person. This has to involve your town. And then we also did have a question about whether or not a disability recreation program could be funded and what stigma really includes. And really, we're looking for things that address stigma associated with mental health, intimate partner violence, or substance use. So a disability recreation program could help reduce stigma around mental health, especially if it includes people with mental health conditions and helps bring the community together. But we really want to be able to see how it would connect to mental health, right? So the main focus of the grant is mental health, but addressing the needs of the disability population in your community could be a great population to look at. Do you all have any other questions at this time?
There is one in the Q&A, Katie, that I thought was worth answering out loud.
Oh, thank you. I forgot about that. I had the chat open, but not the Q&A. How do budget modification actions work? Julie, if you could you
Sure.
take this one for me? Thank you.
Yeah, no problem. Let me just come off camera. So, our goal here is to really reduce barriers to getting you guys, access to this funding. We're not looking to be overly prohibitive. So, we have had in the last 2 grant cycles, towns who came to us with questions about, budget modifications and wanting to shift programs, and we're more than willing to have those discussions. And more often than not, there's no issue with that. So it's just a conversation with us, and as long as it still aligns with all of the principles that, are guiding the grant, we've had no issues with that. So hopefully that helps.
Great. Any other questions? Looks like our presentation did a good job, Julie.
Answered everything.
Yeah. So with that being said, if you have any additional questions or need to reach out to us, you can reach out to me at my email, which is found on the screen. And then I also just wanted to let you know, if you aren't already signed up, next Wednesday, we are also going to have a community webinar at 12 o'clock. So at the same time, same place. So if you'd like to join us, Julie is dropping in the chat the link. So looking forward to seeing you next week as well. So thank you, everybody, and enjoy the rest of your afternoon and your 30 minutes back. We love that.
Oh, we have another question.
Hi, Jennifer. You can unmute or type it in the chat because I see your hand raised. Oh. Oops. Oh, Julie, I think your responses were going to just us. in the
Oh,
panelists.
really?
Yeah, that's
It
okay though.
says, oh, that explains everyone's
Okay.
questions. Okay, let me fix that really quick. Sorry, everyone.
Yeah,
Oh
that's
man.
okay.
Okay. So then let
Oh,
me
and then
fix all of
I
the
messed
things
up
that I
the
said.
link. Yep. Just to follow up on some of those questions I can see Julie answered, but
Sorry, everyone.
it's okay. Yes, the webinar is going to be recorded. It's going to be posted on the website and sent out after the conclusion of this webinar. And then all the grant information can be found on this website, which is just
I
our
know
main
there was a
website. Yeah.
right, and there was a comment that the link was broken. I did double check it and it worked for me. So if you are having issues with that, just reach out to us directly. And then Katie added those other links that I only sent to myself. Sorry about that, everyone.